In the year of 2021, there were an estimated 128,000 deaths caused by measles. These deaths occurred mostly in children under 5 years old who were under-vaccinated or unvaccinated. In 2022, about 83% of the world's children received at least one dose of measles vaccine by their first birthday. This statistic is the lowest it has been since the year 2008. But why is a measles vaccine so important? Measles is not only highly contagious, but it's one of the world's most contagious diseases. It is spread by contacting an infected person's secretions from a cough or a sneeze, but it can also be spread by breathing in the same air that is breathed by an infected individual. Measles is characterized by a prominent rash, but there are many other symptoms and complications. Early symptoms include a runny nose, cough, red and watery eyes, and small white spots in the cheek. They last about 4 to 7 days. One might see this as regular cold, but then a rash begins to develop anywhere between day 3 to day 18. Starting on the face and the neck, it will eventually spread to your hands and feet. Though, it is more than just a rash. Complications can occur that include blindness, encephalitis, which is known as brain swelling, that potentially can lead to brain damage, severe diarrhea that leads to dehydration, ear infections, severe breathing problems, including pneumonia. Measles, it will also weaken the immune system. It'll leave your body not remembering how to protect itself against infections. And if you are pregnant, your baby could be born with a prematurely low birth weight. There's no treatment for measles itself, but care should be focused around a relief of your symptoms and making sure you are staying hydrated. Vitamin A supplements are sometimes given to help prevent complications of eye damage and blindness. And complications are most common in children under 5, but can happen to anyone, especially if you are over the age of 30, malnourished, or have a weak immune system, or you are not vaccinated or under-vaccinated. How can we prevent ourselves and our children from developing measles? And the answer to that question is vaccination. Children should receive their first dose of measles vaccine between 12 to 18 months of age, and their second dose should be around 15 to 18 months old. Measles vaccination can be given alone, but is most often combined with mumps and rubella, which is the MMR vaccine, if you've ever heard of that. Adults who do not have evidence of immunity, they should also receive at least one dose of the MMR vaccine. Some adults will need 2. Anyone who is traveling internationally should be vaccinated. And the MMR vaccine is 93% effective against measles with only 1 dose, but 97% effective with 2 doses. For more information, contact your healthcare provider, your local or state health department, the FDA website, or the CDC's website. Thank you.